Hello, everyone. I'm very happy to be with you here. My name is Carol Guarnizo-Herreño. I'm based in Bogotá, Colombia. I work for the National University of Colombia, Universidad Nacional de Colombia, and I'm very grateful to Manu, Abhishek, and all the organizing team for inviting me and all the team at the project to be with you, to be part of this very interesting, very exciting seminar. So let me share a couple of slides with you, and I will be talking about, the topic of the seminar, oral health inequalities, in this case in Colombia. As I said before, I'm part of the core project, which is community-focused oral health research for equity. This is a project funded by the NIHR, the National Institute for Health and Care Research in the UK. So this is where Colombia is located. We are in the upper left corner of South America, as you can see. And in terms of inequalities in oral health, we know that understanding them is very important, and understanding them in different settings, in different contexts, is absolutely key in terms of being able to understand and then act upon them. So from an academic, but also from a public policy point of view, this is a very key topic. This topic has been generally under-researched in the Colombian context, which is characterized by a complex combination of chronic and infectious diseases, the health, social, and political consequences of a very long-lasting internal armed conflict, more than 50 years of conflict we have had, problems of access and quality of healthcare, a major role of the informal economy, and very profound socioeconomic inequalities in general. Just to illustrate this last point, let me show you this graph, which shows for different OECD countries the number of generations that are needed to go from 10% poorer group in society to the median income group. So on the right side of the graph here, you can see Colombia, where you need 11 generations to go from the group, the 10% poorer group in society, to the median income. So the social mobility is really, really low here. In terms of oral health, we have observed some progress, especially among 12 years olds in our country. However, the last National Oral Health Survey conducted in 2014 showed no significant improvements in adult oral health during the last decade. Moreover, that survey showed a worrying increase in caries experience among 5-year-old children, going from 60.4% in 1993, the previous survey, to 62.1% in 2014. We have, a very profound pattern of inequalities in oral health. So this is an example of social gradients in one outcome, but we have found inequalities in different outcomes. In this case, for the outcome of having 3 or more teeth with untreated caries, we found a social gradient by education, by area socioeconomic position level, also by health insurance scheme, and by income level. When we compare the magnitude of those inequalities in oral health, it turns out that education and the health insurance scheme were the main contributors, the main factors behind social inequalities in oral health in our country. Also, health insurance, the type of healthcare system that we have, or we have had up to now, is the main factor that we found contributing to, for example, inequalities in COVID mortality in our country. And this big socioeconomic inequality has health consequences for other outcomes as well, including birth outcomes and maternal infant mortality and so on. And we haven't seen progress in the last decade, the last years in our country. So I think our project will contribute to tackle oral health inequalities in the 4 participant countries, including Colombia, at least in 4 ways. So first, our project will allow us to better understand how these inequalities are produced and reproduced. So to understand the social, economic, or commercial and political dynamics behind them. Also, because our project has an emphasis on the most vulnerable and excluded groups in our societies, that will help us also to tackle and to understand the inequalities, because usually these populations, these groups are less studied and they are often not included. Some of them are not included in the national survey. So we don't know about them, about their oral health. Also, with the project, we'll have the opportunity to strengthen the relationships with civil society groups, policymakers, other academics, our colleagues in different universities, schools, and other stakeholders to build together strategies aimed at tackling inequalities in oral health. And the project will contribute to further develop research capacity in our countries to study and understand inequalities in oral health. So I think all these and maybe other will be the reasons why I think our project will contribute to tackle oral health inequalities in the participant countries. I wish you all a very productive and very nice seminar. I trust you are all well, and I'm sending warm greetings from Bogota, Colombia. Thank you very much, and thank you.